The main message today is that we've been notified about an infectious measles case that was transiting through Edmonton International Airport February 12th and 13th, and between flights was out and about in the Leduc community. So Albertans who were in those places at those times may have been exposed to measles. At this point, we're asking Albertans, if you were in those places at those particular times, that you monitor your health, you monitor yourself for any new symptoms up to about March the 5th. The symptoms we're concerned about are fever, red eyes, runny nose, cough, and sometimes a red blotchy rash. Usually the rash starts a little after the other symptoms, starts on the face, and spreads down over the trunk. If you have any of these symptoms and you were in those places at those times, please stay home, don't go to school or to work, and contact 811 HealthLink and let them know that you may have been exposed and you now have symptoms. They will assist with starting an assessment in your particular case, and we will sort out the next step to get you assessed and finding out what needs to be done. Very often people with measles are not obviously ill when they're infectious, so it's important to be vaccinated before you come in contact with someone with measles. One dose of measles vaccine is 95% effective, and it's very, very safe. We now offer a second dose of measles vaccine to children in Alberta, and that combined with the first dose gives you 99% protection from the measles virus. Vaccination numbers have leveled out. They're not as high as we would like them to be. Because measles is so contagious, you really do need 97, 98% coverage, at least above 95%, to make sure no outbreaks happen. And our levels are no longer that high. We generally are running from place to place in the 80s and the low 90s. Alberta offers vaccine free of charge to Alberta residents. And if you want to know if you are eligible for catch-up vaccinations, please pick up the phone and call 811. They will assess based on your work, your age, your health, and your past immunization history whether or not you're eligible for vaccinations.